Taiwan is simultaneously in the grips of an influenza epidemic and an enterovirus epidemic. Centers for Disease Control statistics show the number of outpatients seeking treatment for influenza reached a record of 118,000 last week, and there were also 6 deaths from severe complicated influenza, including a 2-year-old child. With regards to enterovirus cases, and there were 2 new severe enterovirus infections, including one involving echovirus 5. This was the first such case in 10 years.
Even though summer has arrived, the number of influenza cases is rising. According to Centers for Disease Control statistics, the number of outpatients seeking treatment for influenza last week reached a record 118,000, or 20,000 more than the previous week. There were also 83 new cases of severe complicated influenza, the highest level in 9 years, as well as 6 deaths from severe complicated influenza. The youngest fatality was a 2-year-old child. Only 4 days passed between the onset of the disease and her death. The CDC believes the influenza epidemic may have been caused by the recent plummeting fronts, which brought lower temperatures. It believes the situation will improve in July. Taiwan is also simultaneously experiencing an enterovirus epidemic. There were 2 new confirmed cases of severe enterovirus infections last week. The patients are a 2-year-old boy from northern Taiwan infected with Coxsackie virus A6 and a 2-year-old girl from southern Taiwan infected with echovirus 5. The latter is the first such case in 10 years. The public is reminded echovirus infection symptoms are atypical and parents must remain vigilant. The CDC says enteroviruses are extremely contagious and children under the age of 5 are easily infected. Frequent hand washing can prevent infection. Symptoms of enterovirus infection include fatigue, brain fog, and difficulties moving.